Hello, my name is Carl Kendall. I'm a professor in the Department of Global Community Health and Behavioral Science at Tulane University, and I'm here interviewing Dr. Ligia Kerr here in Fortaleza, Brazil, in the northeast of Brazil. Ligia is a senior professor of epidemiology in the Department of Community Health in the medical school at the Federal University of Ceará. And she has a long and illustrious history of dealing with infectious diseases and is currently involved in addressing the COVID-19 pandemic here. So without further ado, I'll turn the interview over to Professor Kerr. If you would tell us a little something about yourself and your role in the epidemic.
I have been here in Ceará for last 28 years, and I have been involved in many epidemics before. AIDS is a new disease named the Brazilian purpuric fever, and now Zika more recently, and now right now in COVID-19. So my involvement with this epidemic here came from first an invitation from a colleague, very famous in Brazil, and that called many researchers to restart their early career in public health. We are all physicians in public health, and we have now something different in Brazil after the last president was elected. Northeast region in Brazil didn't vote for him and has been a lot displaced and not receiving the resources that we should be receiving. So because of this, Northeast created something named Consortium, Northeastern Consortium. So this consortium is all the 9 governors reunite in many different areas, now include COVID-19. So I'm part of a group that is giving counsels and scientific recommendation to all the 9 governors to better face the epidemic of COVID-19 in Northeast. So the other claim, I don't know if I talk now, but I also was called by friends that are doing some research. I was invited to integrate 2 groups. One is working with professionals, health professionals, that are the risk among them that are working with COVID-19 patients. And the other research is a group of Pernambuco that invite to be part of research in an island here that has about 3,000 inhabitants. So they asked me to work with them in a cohort study there. So I'm helping to organize this study.
We've shared this list of questions, and so the next question is, are there any bright spots that you can point to in the experience of COVID-19 here in Brazil?
So the last years, we have been just running to give answers to epidemics, and not by mistake. These epidemics are all transmitted by animals to human beings, like Zika, early AIDS, and now COVID-19. They all came from animals, and in some point they transfer. They were able to affect the human beings. And I think Northeast, some is responding different to the epidemic. My state was one of the first states to be to start the epidemic, and has the highest instance in Brazil right now. And the governor and the public health in Ceará is trying to give answers as soon as possible. They start all the social distance as soon as they knew the first case was just starting. Start with a group of high society that have a wedding in Bahia. And then when they came back, most of them came back infected. And we know at the beginning, we didn't know about that. And so the social distance was started a little bit later than this. So they had time to infect many, many people. So if you look at the map in Fortaleza, you see the area where the richest people live in Fortaleza was all red, in fact, with the COVID-19, everybody, most of the cases concentrate in this area. And just more recently, the epidemic is going to the suburbs where, different from the United States, we have most of poor people living. So now we are very concerned about that.
When did testing begin here in Fortaleza?
So this has been a big issue in the whole country. We don't have tests for everybody. So the test is concentrated among patients that are in secondary or tertiary level, and also to health professionals, because they have to stop working in case they are infected. So now we have about 4 or 5 places performing the exam, but not for everybody. It's just for people that are sick or health professionals. And they just expanded, I read today, from 2 to 5 places that are available for health professionals. So it is a big issue. Now Brazil bought lots of tests, the rapid tests, for after the infection.
So why don't you tell us a little something about these efforts to understand what the seroprevalence is in general populations and people who are not symptomatic?
Yeah, so Brazil has lots of efforts around this. First, we have a group, very big, in Rio, Bahia, Pernambuco here. They are working with models, mathematical models, try to based in the experience of the Imperial College, take the numbers and indicators in Brazil and try to build the expected curve of the epidemic. So Ceará started following the curve at the beginning, and then it started being a little bit flatter, but we are worried now with the disease arriving in the epidemic. What we have right now is people die in some neighborhoods where the state of the municipality didn't have any case reported. So people are getting sick, and they were told to not search the health center unless they are feeling bad, really bad, and lack of air. So probably this they are doing, and about 5, 6 people 3, 4 days ago just died in their house or in their way to the hospital. So what we are doing Our scientists now are very advanced in many things. And besides this, trying to monitor the epidemic, they are following the death, they are following the incidence rate, they are following the recovery case. We started having recovery case, but not so many. It's very new, our epidemic started the end of February. And we start a national, I think no country has done this before. We already started a national survey with rapid tests. 133 cities are going to participate in that. We already have one state that's done. They calculate for each case that they know. They have about 5 cases they don't know about. Probably oligosymptomatic or no symptomatic at all. And so we see lots of, they govern, open some calls for research, about 350,000 for each proposal. We are submitting this too. So only my group are dealing with 3 proposals. 2 are red funded, and 1 we are preparing to submit to the Brazilian, most famous Brazilian research institute. Is a federal institute.
The next set of questions have to do with social distancing. Well, what it means here, and if people are doing it, how do they feel about it? How do they accept it?
So we just face a big crisis in Brazil. We have what I call a real crazy president. The president, in any moment, only now, he knows he was losing approval. So he's trying to change his discourse, but he is really against any social distance strategy. And our Minister of Health, that was not a really person that we want there, but he was at least following the recommendations of WHO in terms of social distance. And all the time was the president going to bakeries, going to the streets, giving hands to old ladies and hugging people and saying, Brazil can't stop, has to keep working. And the Minister of Health saying, no, this is not the strategy. We have to stop. We have to, the life is more important. So he was just dismissed, I think last Thursday. And we have a new Minister of Health that the last video we saw him talking, he was saying, it's always a case of choice. If you have old patients over 60 and we have an adolescent, you have no choice. You have to choose the one that's going to live more. So we feel, everybody, the president wants old people to die. It looks like this. It's really a shock for us. And Northeast is like a region living a part of the country, completely apart. But we have 27 states. We have 20 states that did not accept this kind of things the president doing. So when he felt this lack of support, he's trying to change a little bit his discourse. But so this, keep this everywhere for many reasons is not easy. First, this discourse that goes back and forth the president say something, the Minister of Health say another thing. We have another important thing. Before COVID-19, we had almost 12 million people unemployed. And most of the jobs that happened the last 2 years are jobs with no security, no real contract. So people are working more, but are making less money and with no security. So all these people, in a moment, the whole city is stopped. They really are going to suffer because they depend on the work they do in the street. They try to sell things in the streets. They sell food. They sell little things. They go to the beach. They sell coconuts. So this is the way they are living. In the time we can't go to the beach, we can't go anywhere. They are really suffering. So the government took a long, long time to take some measures and has a very timid measure now. He's giving 600 reais. It's 10, a little bit more than $100 a month. So it's almost nothing. Some states in Northeast are giving more, are giving a social completely discount in the electricity bill and the water bill. So they are trying to do that. They are investing lots and lots of money, increasing the number in hospitals. They opened the next hospital that has been closed forever. 2 hospitals in Fortaleza. They just opened and start working. They built, like China, big hospitals, secondary level, and the stadium that was built to the World Cup, the Soccer World Cup. So their building is supposed to be done this week. I saw a video that's showing an entrance. I think it's already working. So I think they're doing a lot. We are one of the first states to start measures for social distance. And the government is really, yesterday, I saw one of the questions here, if everybody's accepting the measures. So we have 2 groups that are having some problems. One is the big business people. They really want the employees. They are going, we call carreata, is a car. You go instead of demonstration, you walk and you go by car. So huge cars. Cars with almost 200,000. You could buy a poor 3-4 house. So these people want the employees to start working. Some big companies are dismissing their employees. So these are people that are really support this government and the federal government, and they really want. So the state government here just stopped these people and took some people to the prison because they started a demonstration yesterday, and the order is stop going anywhere. So they shouldn't do what they're doing. So people were arrested. I don't know how long they're going to be arrested since they belong to the higher social class in the region here. And the other group I already told is the poor people with a very unstable jobs. So the city is working with, besides these measures that they are taking, like not paying water and electricity and receiving the 600 reais a month. They are trying to make, people are making we call a basic basket with food. So people are preparing these volunteers to deliver in streets, deliver to communities, mapping some communities that are more vulnerable. They are doing this great work in one of the big favelas in São Paulo. They have Paraisópolis is the name. So they established a president. This president established many other presidents. So these people went to all the slum, and they mapped all the most vulnerable families. The families and people that are alone or are older and can take care of themselves. And they are forcing to be in the house. They are giving, they receive money from some companies. They bought alcohol. Some families, about 13% of Brazilian population has difficult access to water or irregular access to water. So a disease that you have to wash your hand all the time with soap, how these people are going to do?
So they're using alcohol.
So they're giving some, but I received 2 workers in an emergency here in the house, and decided to talk from a long distance and wear masks. They both are using masks. I was using masks. We are trying to start using masks too here. We are going to start a campaign to use masks. So besides this, I gave him a little jar with alcohol. He was really happy. And I know they are really having a hard time to access the alcohol.
Yeah. So to summarize, in terms of social distance and the things you need to do for the epidemic, there are members of the wealthy who don't want that social distancing. They want their workers back at work. And there's support for the president from that sector. And then you have people who are very poor at the other end of the spectrum, and they can't social distance because of housing conditions, because of the need to go out and circulate to get money for food, and the efforts to address that problem of social distancing.
I also think the government didn't look at these people in time. Prepare the hospital, prepare everything, but I don't see too much emphasis in make them understand about the disease. So they are not taking this very serious. You have a president that say, it's a little flu. This is what he said, it was a little flu. So it's just crazy. So these people, I think, for not understand the message, and the message didn't go there exactly. We just finished a study for students advised by Professor Kerr, and she showed it's part of our research, she showed that the message the government sent many times is not understood by the population. They don't understand what the real message is behind that. So I believe this has also happened, especially with the president giving a totally different message, opposite message.
So the next set of questions have to do with the health sector. And I thought maybe it'd be interesting if you talk about your daughter, who's a physician who's working at a public clinic, and her experience of dealing with the epidemic every day.
So 2 important things about health here. So Brazil has more ICU beds than most of countries. We have a huge public system here that in Northeast is responsible for 80% of the population, completely free. So this public system has been hardly beaten the last 2 years after our president was impeached. So this make the health system more vulnerable to give a good answer, good response to this kind of epidemics. So my daughter works in the primary care of this system, and they have just most of her individual equipment to protect her, professionals' health from getting sick. She bought by herself. So I heard last week the secretary said he only has this personal equipment for this week. We had a big delivery that was intercepted by your president, intercepted France and Brazilian equipment that we are buying. So it was to protect our professionals. So we are really, today, the chair of my department, that's an infectologist, called me, Ligia, sorry, I couldn't participate in the last 2 meetings because I have COVID-19. So he's in fact working in the hospital. They are doing everything. They are following all the rules. But for example, the patient comes, they see the patients outside the hospital in a tent that we have lots of wind here. So they try to make everything they could to not be infected. But it's a disease that has a high chance to infect people. So this is makes all the professionals very vulnerable. In São Paulo, they have, I don't know exactly the number of professionals they have, but 1 week ago, they have more than 1,000 just in the city of São Paulo. 1,000 workers that couldn't work because they were infected with the COVID-19. So we are just starting research, and we think they are gonna adhere a lot because they are always scared. They are always scared.
So you started talking about Carla, but you didn't finish. What's happened with her and personal protective equipment?
So she had to buy her personal equipment by herself. So we have lots of effort of the society. She was lucky because she won from a friend that shield you put in front of your face. So she used a mask, but the mask, the best mask, the N95, she bought some, but doesn't exist more. So we are recycling this mask. So the person that invented this mask gave an instruction by internet how to reuse. So if you have at least 4, you use first, second, third, fourth, and then you put the first after the fourth, you use the second, and like that, you are going to stay 3 days without using. But after that, the Secretary of Health is only providing masks that are not this one, that are the most efficient. So she won this. The clothes, special clothes, she has to buy that. And the glass, before the shield, she had the glass. She had to buy that. So she's really scary. She has 2 children. She has to come back before proposing that group for the government, find a place for the physician, the health professionals in general, not only physicians, to be guests in some hotels. So they did that in China. But the rate of divorce here is 4%. If you don't have, like here, many men They just run away and they don't give support for the family. So, like my daughter, she's alone. So she has to have someone that every week comes back, go to her house and comes back and could bring the COVID-19 to the house. And she could bring the COVID-19 to her house. So it's really, really, she's freaking out with this. She's very, very stressed in her day by day. And just died a patient. She was sick. She missed, was a holiday on Friday. She missed Thursday because she was very sick. We thought it was COVID-19. We don't know. She couldn't test yet. And she knew a patient died in her health unit. So but they sent it back, the old man back to his house. So it's really tough. Many professionals don't want to touch patients. And in fact, in some ways, it's really challenging.
You mentioned that the epidemic began here somewhat late in February. What's the state of the epidemic now, more or less? Let's say last week here in Fortaleza.
So we are reaching 3,000 cases. We have a lethality of 5.8%. Is much lower than some other countries, and but it's increased after some neighborhoods reached 28%. The highest was 28% of lethality. So this is really, really neighborhoods, poor neighborhoods that were not doing the social distance. Most of people left their, it's very common, people have a maid here in their house. So what I know, we live in an area that's very, the gate community. So most of people have has a maid, but what I know, everybody left them in the house. Most people are paying for their salary. I'm paying my maid. She's dying to come back, and I know it's dangerous for you. It's dangerous for us. And I don't know how things are going to be. The last, we are listening many countries when they relax a little bit these measures, just epidemic comes back. Germany is preparing to open a little bit. Let's see the experience of this place. We are far away from this point now.
You mentioned previously some of the research that you were involved in. Would you like to talk about that?
So one is, I have been working with RDS, respondent-driven sampling. That's a method used for population that are hard to reach. So we are, one of the research is trying to reach health professionals in a moment that we don't want to meet anybody. They don't want to meet us, we don't want to meet them. So they decide to do RDS. So first they start, they want to do all together for different health professionals, physiotherapists, because pulmonary disease requires a lot of this intervention, nurse, physicians, and I don't remember the fourth professionals. They are going to participate.
Dentists.
No, I don't think it's no. I think it's just the people that helps the nurse.
A nurse's aide. Yeah.
Yeah, is this one. So I told them, I don't think this, they want to put all together. Oh, they work together. So I told them, I don't think they have a social connection between all these different professions. professionals. So I think we have to explore this. So they made some interviews there, and in fact they figure out they don't go together. So we have to have 4 RDS for each professionals. So this is one. We have questions about based in a questionnaire WHO recommends for health professionals. So we are going to talk to them through, we are building invitation. It's an app that go into the, we start with some seeds. So they receive this app, they install, and they have to invite 3 other professionals to participate. So we are going to start this soon, because the peak of the epidemic is now. They are scared. If you want them to participate without giving any incentive, that RDS is followed by an incentive that you give to the person to participate. The incentive is the fear they are just living right now. So one of the research is this. The other one is we have a cohort study among female young women between 15 and 39 years old, where we explored Zika, chikungunya, and dengue. So we are going to use part of this this cohort to perform the test. Because the research is going to be more, not right now. We are submitting, it's going to take some months until we receive this back. Doesn't make sense you use just PCR. So we are going to use the rapid test to know if the person had or not, if the COVID has some interaction with some interaction with the dengue and these other arbovirals. And so this is the second research. And the third one is this island. The island was closed for tourists. It's an island that can be explored. People to live there requires authorization of the government. They need a kind of acceptance card to live there, like the green card. And it's a tourist place. You have a certain number of tourists that can go. It's a very preserved island. So they closed the entrance for tourists. People that are living there and want to go to the continent, they can go, but if they go, they don't come back soon. They have to know if they're leaving, they can't come back soon. Only 1 month. We don't know how long it's gonna last this. So we have 26 confirmed cases there. We have 13 suspect cases there. So our intention is to try to understand how the epidemic is gonna work in a closed space like this one. 30,000 people.
3,000.
3,000.
Yeah.
Sorry, 3,000 people. So we are going to start a cohort, and every 21 or 30 days, we are going to collect the data 3 times, and probably one longer when they make more flexible the epidemic. So this is our intention. Every case there, because it's an island that the militaries take care, so it's very tough. So every case that happens, they investigate all the family and they try to block the disease. This is our intention, to see how much they can or cannot block the disease. So these are the 3 research we are involved in right now.
Great. So you started this interview by talking about this this Northeast Consortium that was set up by Mauricio Barreto. And so perhaps you could describe a little bit about the network of scientists that are involved in that, the network of academics who are working in this network and what you're doing.
So this consortium was created, think at the beginning, more about how they could survive a president that is boycotting them. So they tried to unify 9 governors, and they start doing, for example, buying things together from outside, negotiate with China and other countries directly. So at the beginning, it was more like economic things, and then came with this epidemic. So they noticed they had to have help from scientists. And so they are all, in some ways, left-wing governors. So they are not this crazy president that doesn't believe in science. So they search for people that could advise them and be an assessor for the epidemic. So the epidemic is something huge and broad. So this, one of the researchers that was invited to help in Bahia, he decided that this is too big to work alone. So he invite me and then asked me, if you want to invite other people to be engaged here, feel free. So I invite Carr, invite people in different areas here. So we are a group of, today I think 4 or 5 here. And so we work with social distance. What are we gonna do? How are we gonna solve this problem? What you're gonna recommend to the government, based on what we're gonna recommend to come back or not, to make flexible or not. So we have to be prepared to give answers, to technical answers to the government. So this is what we are trying to do. So we are trying to improve the indicators that are used to make this model of the curve, because the curve is very dependent on how good is your indicators, how the numbers you introduce in the model. So we are trying to improve the information, improve all the death, all the cases, the highest number of cases. So the state just bought we have a very good public laboratory in all the states. They are working 3 times. Part-time is 3 turns of the day. They have 24 hours. And they only can perform 350. The highest number TC, PCR tests a day. So it's not enough. So Ceará and I think Bahia, Pernambuco, the 2 big states, Bahia is bigger than this, but these 2 states bought that machine that's able to perform. I don't know if they bought a machine that make 800 or the one that makes 4,000. I don't know which machine they bought, but I know they bought a machine that is going to increase the number of tests and expand. Brazil is almost not testing anybody else that's not in the hospital or is bad, requiring more assistance, or health professionals.
Mm. So wrapping up the questions in this interview, one question has to do with what it says, how would you do things differently if you could about this COVID-19 epidemic?
This is a tough answer. Yeah? We have a association here named Abrasco. It's a Brazilian association of people that work with public health. And Abrasco is beating the government because most of things they are doing is against public health. And they also start some programs three times a week. And I was invited to the first panel of researchers to talk about the epidemic. And I think it's a lesson that's not only for Brazil, but it's also for the whole world. If you don't understand the orange and the cause of this virus, we are going to have a second, the 19, the 20, the 21 the COVID or the coronavirus or other virus, because we are destroying the forests, we are destroying the habitats of many animals and plants. And some plants we can't find anymore in the world. Some animals we can find more in the world. So we destroy this, and then they come with their parasites that in general never did anything to them. And they come to the cities. It's the case of China. The pets don't have their place to live anymore. They come to the farms, and they transfer or directly to human beings, or they transfer to animals like porks and cows that are confined in a big space. I heard that some farms can have 30,000 animals. So what happened with these animals? They decrease their immunity, they are affected by the virus, and then they die, or they infect human beings. So we're going to have lots and lots of problems in the future. 60% of the emergent disease now, emergent or re-emergent disease, they are coming from animals that can transfer their parasites to human beings. So we need to face this. And I think it's going to be tough for a world like we are living, an economy that only money is the main interest. No matter how you find this, no matter how you get this. The other thing I think is very important is recognize that more than ever, a system like ours is necessary. People can't afford health. Health is something very expensive. The last, before the president that came over, the president was impeached. They put the country in a fixed budget. We can't use more to the health than is right now. Only what the inflation comes. But health is not someone that's going up like inflation. Look at the cost of equipment like that to make 4,000 tests, when we thought we would have a need for thousands of PCRs a day. So it's very tough. So I think we really have to think about this time we are concentrate in our house to think which word we want after this. Yeah, I feel sometimes incapable to do something, but I'm talk every place I can. I talk my research, but I claim that we look the word and what we are doing to the nature, and we have to stop this, to have this relationship with the word.
So two things: this relationship with our environment and changing that relationship on the one hand, and on the other hand, having a universal healthcare system.
I think every country should think about that. Was incredible. Listen, Macron recognized that this neoliberal economy is a disaster. Things like them, they have a good health system. England, Italy, what happened? What happened? Look at the country that could answer fast, like Germany. They have a very low lethality. So we are going up. We are not the worst at all. We are much better than that. But for example, Argentina is doing much better because they really enforce all the measures. They are doing better than are doing. So it's tough. Democracy. We need democracy.
Okay. The last question is, would you be willing to speak with us again in a few weeks to find out how things are going?
Certainly. Let's see how fast we can go with our research and answers to the government and help the government to deal with this terrible epidemic we are facing right now.
Great. Thank you.
You're welcome. It's a pleasure.